What are the possible side effects associated with taking the vaccine?
Most of the side effects that we've seen published in the literature are very similar to the side effects we see after any vaccine, because the side effects are the recognition by the body that there's something foreign in the body. And when you have influenza or you have chickenpox or you have measles, the first thing the body says is, aha, I need to get rid of this infection. So it mounts an immune response. It produces artillery. That artillery produces the temperature. It produces a little bit of ache where the infection is being seen, where the vaccine has been given. So you get a little bit of muscle ache, you may get a bit of fever, sometimes a bit of a headache, just like you're having flu. And that is the majority of cases. There are a few isolated cases where it becomes a much bigger issue, you know, and very rarely, I mean probably 1 in 100,000, where actually you get symptoms that need admission into hospital. So it's very rare. You know, I mean, a lightning strike is 1 in 10,000. A side effect of a major type to the vaccine is 1 in 100,000. So you know, there's a lot of fake information going out there that people, you know, will succumb to this. People may get infected by the coronavirus. There's no such thing as that, because this is a spike protein. It's not even the virus itself. It's a part of the virus. So you cannot actually develop a viral the virus can't begin to grow in your system because there's no virus in the system. So those are the side effects, and they're very few. It is important to remember, Poranseko, that these vaccines that are in development are different to, for example, the measles vaccine, because once you get the vaccine, it does not mean that you cannot pass on the COVID virus. You yourself may have a substantially reduced 90-75% reduction in risk of getting symptoms of COVID and actually therefore succumbing to COVID. But if you are then if you get the COVID virus, you may not get infected by it, but you may be able to pass it on. We call that, in other words, you are not sterilizing the virus. So these vaccines don't produce sterility. And this is the issue, that people out there must not be under the misinterpretation and the disinformation that's out there, that once you have the vaccine, you are free. You are free to unmask, you are free not to wash your hands, you don't have to socially distance. Life is not going to be the same as pre-COVID after the vaccination. We will still need the mitigation factors. We will still need to socially distance. We will still need to wear a mask. Because remember, even if there's a 95% effectiveness, there's still a 5% chance that you may get infected and you may be symptomatic. Or there's a chance that you will pass it on to somebody who has not had the vaccine. So we need to be sensible about this, and I'm sure the information will come out from our Ministry of Health about how we need still to be protective for years to come, because we need to build up, like we talked about, the issue of herd immunity, where enough of our population, it's estimated by scientists, at least 70% of the population is vaccinated for us to be seen as having any sense of order and decorum to go back to some form of outdoor living.
Can a person take the vaccine if they've already been infected by COVID-19, or, I mean, this is previously, or still infected?
Yes, you should take it, because once you've got COVID, you may be protected for a few months, but there are studies that show you can be reinfected. You can get another bout of COVID if your immunity wanes. Therefore, taking the vaccine after you've been exposed to COVID cannot do you anything but good. There's no harm in taking it. So we would recommend, as is recommended by WHO, that the vaccine is given to everybody across the nation. Clearly, when the vaccine does arrive, it will be given to frontline workers, it will give to teachers, it will give it to people who are working in the industry that are exposed to the population at large, and then the elderly, and then gradually in a decreasing cohort, people of a younger and younger age. But we wait to see what the Ministry of Health comes out with in terms of that program. We do know that WHO is working with a campaign called the COVAX campaign, which is a program where the vaccine is going to be dealt at a much cheaper rate across the continent, and we just wait to hear with crossed fingers the speed at which that arrives. Don't forget, the other thing that's very important for people to understand there is that the trial data conducted by the research companies are done within a very controlled environment. Vaccines need to be kept at a certain temperature. and the AstraZeneca vaccine needs to be kept at 4 degrees. The Pfizer vaccine has to be kept at minus 70 degrees. Now, these are refrigeration capacities which we are going to find difficult to maintain. If you're going to give a vaccine to population in Shakawe or Etsa or Saronga, these are difficult places to access. So maintaining that cold chain, maintaining that temperature is not going to be the same as they did in North America and Europe, where they did it under controlled environments. So the logistics of rolling out the vaccine in Botswana are different to the vaccine rollout in Britain. So these are also issues that we're going to have to be facing. The other issue that we're facing and that we will face are the fears amongst the community in terms of, will the vaccine convert my DNA? Will the vaccine cause issues? And there's a lot of anti-vaxxers out there that believe a lot of the nonsense that's gone out there. All of this is fake news. It's really important for the public to understand that this is an important vaccine, it's an important advance, it will protect our country and our people, and there are no side effects on a long-term basis that we are aware of so far, and they should take the vaccine. As doctors, we take the flu vaccine and the hepatitis vaccine on a regular basis to protect us and our patients. This is going to be part of another part. I also foresee in the business industry vaccines being compulsory before you come back to work. Vaccines being compulsory if you go into a restaurant. If you go into people who own businesses may insist that before you walk into their business, you show that you've had a vaccine. These are things for the future that I'm sure are going to be part and parcel of 2021, 2022. People who've been traveling, people who are going onto airlines, the airlines will insist, not now that you have a COVID test, but that you've been vaccinated against the coronavirus. So these are important legislation issues that will become important. Currently, we're having an issue in terms of supply of vaccines, and it becomes a moral and ethical issue because we now know that there's been hoarding of the vaccine in North America and in Europe. We know that Canadians have ordered double the amount that they actually require, and so have other countries, and we're wondering why this has been the case when it becomes a moral and political issue that we need the global, nobody's protected until everybody's protected is the campaign. And so these are political issues that will play themselves out, but I'm pretty certain by the end of the year there will be more than a dozen vaccines out for distribution, because a lot of trials are going on and the race is on to distribute the vaccines.
Say I've taken the Moderna vaccine, right? And then I want to switch to Pfizer or Sputnik. Is that possible, and is it advisable?
In terms of switching vaccines, it's a good question. If you've taken the Sputnik, which is the Russian vaccine, or the Sinovac, which is the Chinese vaccine, or you've taken one of the British vaccines, which is the AstraZeneca vaccine, and suddenly a new vaccine arrives on the market, can you switch? And it's a very interesting question, and the answer is probably it may not be a bad idea, because different vaccines work differently. So we are not sure, because we don't have the trial data from the Chinese or the Russian vaccines, but we know that the AstraZeneca and the Pfizer and the Johnson & Johnson vaccine work slightly differently. And so there is possibility that crossing the vaccine by changing from one vaccine to another in terms of the dosing may not be a bad idea. It is true that currently we're debating, because most of the vaccines are a vaccine that you have to give as 2 doses, separated by either 3 weeks, or in the UK they're trying 12 weeks, trying to try and get the first dose out to as many people as possible. We're not sure about the timing of the vaccine between the first and second dose. But in countries like ours, Ponasego, it's really important to understand Botswana is not Britain, and that getting the first vaccine into the public is fine. Getting them to come back after 3 weeks is going to be a logistical nightmare. As it is, we get problems, patients coming back for their blood pressure checks or their cholesterol checks. Getting them to come back, or getting the transport to bring them back for their second dosage, is also something we as the health professionals are going to need to battle with, to try to make sure that they are completely immunized.